Good afternoon, everyone. This is Dr. Martin, the Institute of Regenerative Education. Happy Wednesday. We had a call cancel, and so it gave me a bit of time to be able to film this. Now, there are all sorts of reasons that I shoot videos, but more and more and more, we're seeing kind of this shift in medicine. And that shift in medicine is providers that have been doing oncology or gerontology or internal medicine or pain medicine, OB-GYN, orthopedic surgery. And let's just say they're burned out. They're just done. They're completely tired of getting paid trash by insurance. And where the kind of sexy newness used to be starting in aesthetics clinic, where everyone was doing aesthetics, right? We had podiatrists doing Botox. We had everybody doing Botox. Well, Botox is kind of dead, right? Now, not that people aren't using Botox. It's just that the money maker in an aesthetics practice has shifted. It's no longer Botox. People are barely breaking even with Botox. Botox has gotten super expensive. Dysport has gotten super expensive. The Groupons and the discounts and the price per unit have gone down so much that any revenue you were making in Botox has kind of vanished. And so we're going to do a lecture today on what is the hot newness. And so we're going to call this lecture, we're going to call it the Med Spa Magic. Now, in order to make a little med spa magic, you have to have a funnel. Botox has become the funnel, and always was, for every cosmetic clinic, every kind of regen, every aesthetics clinic, because aesthetics was just the hotness for like 10 years. It's not anymore. This is the new hotness. But in order to make magic, you have to have a funnel. Botox was the funnel for aesthetics clinics. Weight loss clinics, GLP-1s was the funnel for those clinics. And so if you're going to have a med spa, you need to have a funnel. Now, most of you have seen me lecture on what I call the Coeur d'Alene protocol. And this is kind of the Coeur d'Alene protocol. It is an IV-based protocol, and my marker stinks, so we're going to grab another one. That Coeur d'Alene protocol was really set out based on a paradigm of using IV application. Now, IV application is still King Kong. It's still very, very, very popular, but it's expensive. Because in this paradigm, where I'm giving 180 billion exosomes, which is nanosomes, by the way, from Plano biologics, plus 3 supplements. Actually, this ends up being 2 supplements and usually 1 peptide. In this 50 billion paradigm is nano air from Platinum Biologics, and typically 1 supplement. This price point is roughly $1,500. This price point is roughly $3,000. Those are pretty high price points. And not everyone can afford that. I talked to this wonderful provider, and she spent $30,000 over the past 6 months to try to build an online funnel, and she got a lot of leads, but she wasn't closing her leads because her price point was around $3,400. And so if this is the Coeur d'Alene protocol, we're going to call this the Plano protocol. Now, I'm in Plano, Texas now, and so it's only fitting that we call something the Plano protocol, because it doesn't exist. Now, the Plano protocol, and I'm going to have to say that like 5 times fast, was born out of my environment. Literally, I moved to a brand new area. I'm going to start a brand new clinic. And if I'm in a brand new area with a brand new clinic, I need a hook. I need a reason for people to come to my office and see me. And the price point better be aggressive, and the offering better be aggressive as well. And so what I created was this Plano protocol. Price point aggressive, also based on value. The cord-derived protocol was so popular because it was based on value. If you spent $1,500, you got 50 billion exosomes in an IV, and you got to pick a supplement that was complementary. For double the money, for $3,000, you got 3 times the exosomes. But you also got 3 times the complementary supplements. You got, most people were doing 2 supplements and 1 peptide. And so we're going to mirror that with the Plano protocol. But price points are going to be very, very, very aggressive. And let's show you how and why. The 2 products we're going to use are Renew Exo. Now, if you're not familiar with this product, it's a brand new product by Plano Biologics. It is a lyophilized exosome. It's a 10 billion exosome that can be given by sub-Q application. Now, this is hot. So all of you who have peptides, all of you who have clinics where maybe you can't put in an IV, and you need a way to get people into your clinic. You want a hook. Renew XO is 10 billion exosomes. It can be given sub-Q, right? And the price point is aggressive. It's around $100. So what am I going to charge? I'm going to charge something like $300, right? So for $300, you get Renew Exo plus 1 supplement. Now, ideally, that 1 supplement you're choosing is probably going to be a peptide, something you can give sub-Q. Now, do you necessarily have to give TB500 or something like that? No, right? What are the things that you could potentially give? And let's just do it this way. Let's do Renew Exo here, right? For things that you could give sub-Q, right? That would be a price point aggressive sub-Q application that aren't peptides. What can you give? Oh, you can give B12. People love that. You can give vitamin D3. Tons of perimenopausal women, tons of men who are working out and biohacking, they have some vitamin D deficiencies. It can be given IM or sub-Q. IM's a little bit better, right? But there are tons of other things that you can give sub-Q, right? There are all sorts of things, right? It's not my favorite, but you can give vitamin C sub-Q, right? Find a list of things that you can give sub-Q and offer it in with Renew XO. B12 is probably one of my favorites, right? I also like zinc. I like zinc a lot, especially for immune support, right? Now, if your Renew XO, which is just a sub-Q application, is $300, let's do the math on this, right? Let's say our B12 cost us $10, minus 10 for our B12, minus $100, right? So we're making basically, whatever, 200, well, about 100 and let's call it $90, right? But for all intents and purposes, we've got some overhead in there. So let's say our net is roughly $150. And you may say, well, Dr. Martin, that's not very good. $150 net, that's not great. I'm not impressed by that. I would say you're stupid, right? Why would I say you're stupid? Well, what's the most common thing providers do in their office? Oh, a joint injection. Well, Dr. Martin, how much is the net on a joint injection? Well, Medicare pays $59.95 for a joint injection. The majority of your patients are Medi-Medi, so you're getting 20% less than that. 6 and 2 is 12. right? So you're getting about $48 for your joint injection, right? Less 65% for your overhead, right? Even let's call it half, right? That's $24, right? Then you got to pay for your Depomedrol, which is $10. So you're making an average of $14 on your joint injection. You're making $150 on sub-Q injections. Now, which carries more risk? Putting a needle in a knee joint or a shoulder joint, or giving something sub-Q? This is way easier. You can see a ton more patients in a day, and it's value-based, right? So Renew XO +1, hot, sexy, love it. What about Liquid XO? I've never heard of that, Dr. Martin. What's Liquid XO? Liquid XO is a product that actually my wife created. Now, I'm not smart. I've told everyone that. Everyone watching this video is smarter than I am, right? But you're probably not smarter than my wife because she's brilliant. She's been an endocrinologist for 25 years. She's worked with peptides. She's worked with GLP-1s well before they were ever used for weight loss. But she's seen so many patients on GLP-1s suffer from sarcopenia. Anyone who's on a GLP-1 will lose weight eventually. Sometimes they lose weight precipitously. The issue is that up to 40% of that weight loss can be muscle loss, sarcopenia. And so how do you combat that sarcopenia? Well, the first way to do it is typically essential amino acids. Now, how do we ingest essential amino acids? Typically oral, right? Well, oral administration, gummies, shakes, drinks, you have a first pass effect. And that first pass effect can reduce the efficacy and the potency of those essential amino acids 30, 40%. And so her idea was to blend essential amino acids with exosomes, so the exosomes would literally carry leucine-rich essential amino acids directly into muscle sarcomeres. That is hot. It can be given as often as every other week because most people are giving peptides every other week. Now, this is an IV application. So the application is 10 billion exosomes plus leucine-rich essential amino acids. It's an IV application, and the product is also $100. So how do we position this? We position it just like we would our 180B plus 3. It's a Liquid XO plus 2, right? Now, what do I recommend? I recommend a price point around $500, right? $500 is the price of PRP. It is dirt cheap. Most people are charging $500 for Myers cocktail. So for $500, what you're typically giving, and let's do Liquid XO here, right? What are we doing with Liquid XO? Well, we're using these lists here, right? So in our IV, right, we have our IV, and we typically are going to give in the IV a supplement plus one sup plus one sub-Q, right? So in the supplement, we could give anything like Myers. We could give glutathione. We could give zinc. We could give biotin, right? We could give any of those things. The sub-Q, we use this list. B12, D3, vitamin C, zinc, some of these other things, right? Maybe N-acetylcysteine. Now, we're not talking about adding a peptide. We're just talking about adding supplements. Peptides, whole different story, right? GLP-1s, whole different story. And if you want to bundle Liquid XO with a peptide, you're more than welcome to do that. And so that scenario, because most peptides run us about $50, let's assume that you're going to do one supplement and one sub-Q, but your sub-Q is potentially these or a peptide. And let's just assume price point for that peptide? Well, it's $500 for your IV, less $10 for your sub-Q, less $50 for your peptide, less $100 for your liquid XO, right? So where do you end up? You got about $160 here, plus 40, ends up being 200. You end up making $320. That's fabulous. That's fabulous. And before you tell me it's not, $320 is more than podiatrists are making doing bunionectomies. Because a podiatrist doing a bunionectomy makes $420 less 20%, because most of their patients are medi-medi, right? So you're taking $80 off the top. And then you got overhead on top of that, right? 65%. They're making about $50 a month for 3 months to do a bunionectomy. You did an IV with maybe 250 or 500 cc's of fluid. It took 30 minutes and you made $320. Now let's just do the math on this paradigm, all right? Because the maths. Let's say we see an average of 5 patients a day, 5 days a week. All right, this is not a lot of volume. Not a lot of volume at all, right? And if we take the average of $150 and $320, we end up with around $200, right? 5 patients a day, 5 days a week, we're looking at 5 and 5 is 25, 25 patients a week times $200, right? We're mathing okay, right? We're making around 20 grand a month. That's pretty damn good for a med spa with no high ticket items. The most expensive thing you're offering is $500. Why did I create the Plano protocol? As a funnel to get people in the door. Because once people are coming in the door for Liquid XO or Renew XO, guess what they're going to ask? Do you have anything stronger? This Plano protocol is the foundation to introduce the cord-derived protocol. This is your new Botox if you're a med spa. This is how you get them in the door so that when they ask for more, you can flip them into the cord-derived protocol. Now, I did a whole lecture on this. If you want to watch that lecture, you want to watch the lecture called Sushi Regen. It's probably 40 minutes, all right? But this is a very down and dirty paradigm. Again, Plano protocol. We're using a sub-Q application and an IV application. Sub-Q application at a low tier with a price point walking in the door of $300, where if you can keep the other things that you're going to give sub-Q reasonably priced from your compound manufacturer, your net can potentially be around $150. At your higher price point, $500 for the patient, you're offering 2 freebies, typically a sub-Q application and then another supplement that you're going to add to the IV. You're doing that IV in typically 250 cc's or 500 cc's, right? And your net's probably around $300. This is a fabulous funnel if you're looking at trying to bring people in the door in a cost-effective manner where they could come for this at $300, they could come every week, right? This, they could come every 2 weeks if they want. They could come every week if they want. What's the goal? The goal is to provide a price point that's attractive for patients, to provide value by offering complementary services, and to build a funnel that you can control. Because once the patients come in, they get amazing outcomes with these products. They are going to invite friends, family, cousins, nephews, neighbors. And at some point, somebody's going to say, what's stronger? And then you introduce the quarterly protocol. And then lots of people from this side move to this side. And your revenue goes well above 20 grand a month. I'm Dr. Martin. Please have a very blessed day.